Okay, so here's a quick capacity check-in for us. And this is how you know, right, if you haven't done this recently. If a patient wants to schedule an appointment in hygiene, how long are they going to wait for that appointment? If a patient wants to schedule an appointment in hygiene in prime hours, how long are they waiting? What hours should we be open to best serve our patients? And are we maximizing all the times available? Okay? So what do patients want? This is the topic of the last retreat. Remember, expanded hours are an expectation of more than half of our patients today. It didn't used to be that way, but it's evolving to that, right? Remember banker's hours? And now what do we see? 24/7? Accessibility is really critical for our patients and consumers of today. We've seen this shift to a higher focus on consumerism rather than we're going to do it this way because that's what we want to do. Okay, so appointment availability check-in. Are you offering early and late appointments, lunch hour options, any treatment done any time of day? So that's one thing that's kind of interesting. Sometimes we see a practice that's historically reserved X amount of time in the morning for surgical procedures or whatever it may be. And so someone will want to schedule an appointment at that time and they're told, yeah, we can't do that. Right? Again, that's an example of not having appointment availability and expanded capacity. Are you able to do same-day emergency care? That's a quick capacity check-in for you. All right? Chairs. Let's do a check-in on ops and chairs that we have. Okay? When are they full? Are they full all the time? Filling the empty chairs hours fallacy. Again, Dr. John's told this story many times where he felt like he had plenty of capacity because there were times throughout the day that he had empty chairs in his 21-op facility. This is before they were 21-ops. I think they were 15. And so his way of thinking was, I have open chairs at some times of day, therefore I have plenty of capacity. But that's, in a way, a myth or outdated thinking, because if you think about it, when do patients want to come in? If we had more chair time or more availability during those high-demand appointment times, what do you think is going to happen? You're going to see more patients during those times. So being creative about how we utilize our space is also part of this, right? If we have semi-operational ops, do we get rid of those? Have we looked at expanding hours, especially during that prime time appointment expansion? These are really important measures that you can be taking to identify where your biggest opportunities lie when it comes to capacity. Okay, so maximizing that facility, what can we do? We mentioned this morning, we talked about split shifts, right? That's a powerful way to optimize opportunity. Frankly, when I was practicing hygiene, I took the early morning shift and I loved it. I worked 7 to 3, no lunch, straight through. It was amazing, okay? There are other providers that would absolutely not want that, but they might like the later shift. They might want to get up and head to the gym and take kids to school and do all those things before they actually head to the office. So you never know until you actually ask, what's your preferred time frame? If you could choose a 7 to 3 or a 12 to 7, which would you prefer? And what you'll find is often the team gets behind that when they're given the choice. They might want 2 days early, 2 days late, right? So once you actually chart it out, schedule it out, and then put that in front of the patient and say, hey, these are the shifts we need to fill, team. What would be your ideal? What's funny is how often these things work themselves out. Okay, so we can do split shifts. My favorite example, sometimes we learn a lot of what not to do, right? So I actually had a neighbor and a good friend that said, hey, I need some help in my practice. We're really not doing very well. There's 2 doctors, 2 hygienists, and I'm like, oh, awesome. How many chairs do you have? And you know what the answer was? 4. 2 doctors and 2 hygienists were trying to work out of a 4 practice. And guess what their hours were? 9 to 5 every day. All were there at the exact same time. And we look at that in this room and we're like, idiots, right? We're like, come on. Are you not thinking? But again, we think differently, right? So one of the very first things we did was we said, it's ridiculous that both doctors are there at the exact same time. You got to split that up, right? You got all these hours that these chairs are sitting empty because, of course, nobody wanted to work the Friday or the Saturday. You're going to be so much more productive if you are able to split that up, right? So again, thinking differently is important. Every day, days of the week, when are you working? When do you have opportunity? Are you using creative scheduling or a hygiene blitz to help us catch up if we're out of capacity on the hygiene side? And if we've tried this, how effective was it? Did we have team support? I've had a couple conversations with some of you this weekend that said, not really. We did not have team support. They didn't get the vision. Okay, so how do we change that? Does that mean we tried it once, it didn't work, so we're not going to do it again? No. It means we learn from what didn't work, we refine that, we improve upon it, and we present plan B, Hygiene Blitz Day number 2, the next generation, new and improved version, right? And we have to help them see the vision of why this makes sense. Okay, so again, in the middle of difficulty lies opportunity. We know there's plenty of opportunity to serve patients better, but we are the ones, as leaders in our organizations and our practices, that drive those opportunities.